Welcome to the MPro eCigarettes, which you must know. Your host, Mahak, will now begin.
Good afternoon, everybody, and welcome to our Disparities in Cardiac Health Program April webinar land. We would like to get started with a few announcements. The first set of DASH announcements are that you can follow us. You can follow MPro on Twitter, Facebook, and LinkedIn. Our final DASH newsletter will be coming out the first week of June. Quarter 5 data was due on April 15th. If you have any questions, please email us at dash@mpro.org for technical assistance. We will be scheduling meetings to discuss data and interventions with all practices. For our listserv, you can email us at dash@mpro. The GAE awards are going to be happening in 2 weeks on May 9th for all lands. We also are collaborating with our cardiac land and prevention land for this webinar. For cardiac land, data reports for baseline 2014 and quarter 9 are now past due. Please contact Tiara Lovejoy at tlovejoy@mpro.org if you're experiencing issues. Patient education toolkits were mailed last month. Please contact Tiara as well to request additional copies. For the prevention land, you can access the Prevention Land podcast series on demand by going on our mpro.org website. Our upcoming webinars, our next one will be on May 21st, and it will be on stroke information presented by Dr. Michener, an ER physician. There is also a free collaborative PQRS webinar available on May 14th, 2014. You can email lsawyer@mpro.org, and you can register for it through our website as well. And now I would like to introduce to you our today's presenter, Laura de la Rambelje from Michigan Department of Community Health, the Tobacco Control Program. She's a public health consultant there. Ms. de la Rambelje supports local tobacco control coordinators in the Southeast Michigan area with a particular focus on addressing tobacco-related health disparities. Ms. de la Rambelje also serves as staff lead for the 24/7 Tobacco-Free Schools Initiative, Youth and Tobacco Use, as well as hookah, e-cigarettes, and other new generation tobacco products. I would like to transfer this to Laura.
Good afternoon, everyone. As Mahak said, thank you so much. My name is Laura de la Rambelje. The title of this presentation, of course, for MPro is eCigarettes, What You Must Know. The title I use is The Tobacco Playbook Deja Vu, eCigarettes. I just want to put that out there because a lot of people don't consider e-cigarettes to be a tobacco product. We do consider e-cigarettes to be a tobacco product, and that immediately gets you into the sort of mindset of, okay, what's going on with this particular product? So what is an electronic cigarette? An electronic cigarette, or an e-cigarette, is a product that allows a user to inhale vapor containing nicotine and other substances. Unlike conventional cigarettes, e-cigarettes are typically composed of a rechargeable, battery-operated heating element, a cartridge that may contain nicotine or other chemicals, and an atomizer that, when heated, converts the contents of the cartridge into vapor. What are e-cigarettes not? E-cigarettes are not an FDA-approved device for quitting tobacco and should not be marketed as such. E-cigarettes are also not a safe alternative to other forms of tobacco. In spite of this, we're seeing a lot of false claims, as you can see from the photographs that are at the bottom of the slide. A lot of e-cigarette manufacturers are making claims that they are healthier than cigarettes or that they will help you quit. At this time, we are still awaiting the release of proposed regulations to cover e-cigarettes as a tobacco product from the FDA. And just so that it's absolutely clear, the FDA cannot regulate e-cigarettes as a medical device unless the company submits its product for the same scrutiny as any other medical device. This is according to Cetera Inc. versus Food and Drug Administration decision of the D.C. Circuit Court from 2010. To date, 0 e-cigarette companies have submitted a device for such standard testing. And at this time, there is no federal law prohibiting the sale of e-cigarettes to minors. So what is the situation about e-cigarettes here in Michigan? Currently, it's still legal for minors to purchase e-cigarettes, e-hookah, their components, or refills. E-cigarettes are readily available throughout the state. Flavors include cherry crush, cookies and cream, milkshake, or any other candy or alcoholic beverage flavor you can imagine. They are found in malls, standalone stores, gas stations, bars and vending machines, and tobacco specialty retailers. They are also found in pharmacies, frequently positioned next to FDA-approved nicotine replacement therapy, contributing to the understandable confusion among patients when they end up in your office or they end up speaking with us on the street from the tobacco section asking questions about it. They say, hey, I thought it was a tobacco dependence treatment product, and it's not. Many of these products also cost less than $10, and they go up from there. Currently, e-cigarettes and their components are not subject to the tobacco tax, and at this point right now, there are various e-cigarette bills that have been introduced in the Michigan legislature to curb youth access. 3 bills would amend the Youth Tobacco Act to prohibit minor access to so-called alternative nicotine products. Both Governor Snyder and Michigan's Chief Medical Executive, Dr. Matthew Davis, have called for e-cigarettes to be treated as tobacco products. So what are the health concerns? There are quite a few. The first is poison. As you can see, between 2010 and 2012, the American Association of Poison Control Centers reported rising incidences of exposure. On April 3, 2014, the CDC released a new MMWR that showed that the total proportion of poison calls to poison control centers across the nation jumped from 0.3% in September 2010 to 41.7% in February 2014. The total number of poisoning cases is likely higher than reflected in this study because not all exposures might have been reported to poison control centers. What does it take to become poisoned from nicotine? Nicotine, first of all, as you can see, nicotine exposure, so whether through inhalation, ingestion, or skin contact, can be hazardous to the health of anyone, in particular children, young people, pregnant women, nursing mothers, people with heart conditions, and the elderly. Consuming 0.1 to 1 milligram of nicotine per kilogram of body weight is considered to be a lethal dose for a young child. Most toddlers weigh about 10 kilograms. Most e-cigarette refill bottles are approximately 10 milliliters, which is over 10 times the expected lethal dose for a child. This is the same as 2 teaspoons of e-cigarette fluid. Nicotine exposure is also a rising concern for those who refill their own e-cigarette cartridges and for those who decide to brew their own homemade e-juice in their basement. We also have the concerns regarding primary and secondhand vapor exposure. Some studies have indicated adverse health impacts for both the user and the bystander, but additional studies are needed to confirm this. The studies that have come out have shown, though, that propylene glycol, which is the active ingredient in many e-cigarettes, is quite dangerous. It is found in asthma inhalers. However, no study to date has investigated its impact as used in e-cigarettes. For example, with an asthma inhaler, one would only use an asthma inhaler 1, 2, or 3 times in a day, and then at that point would go to the hospital. E-cigarettes, a typical disposable type, will have 400 actuations in that e-cigarette, and frequently users will go through an entire disposable e-cigarette in one day. 400 puffs is roughly equivalent to a pack and a half to 2 packs of cigarettes. Additionally, when heated and vaporized, propylene glycol can form propylene oxide, which is an IARC Class 2B carcinogen. Glycerin or glycerol forms acrolein, which can cause upper respiratory tract irritation. Dow Chemical, which is a propylene glycol manufacturer, recommends not vaporizing propylene glycol. At one point, propylene glycol was used in theater fog machines, and they've discontinued that use. Remember that while propylene glycol and glycerin are approved for ingestion, this is not the same as inhalation. Another study has shown that secondhand exposure to e-cigarettes results in involuntary exposure to nicotine. The long-term impact is currently unknown. Remember, nicotine is a stimulant. While much is not yet known about the impact of using e-cigarettes on cardiac health, preliminary studies have shown that e-cigarette use does increase heart rate in a manner similar to conventional tobacco use. But what we do know about nicotine in conventional tobacco use would still apply. Per the Surgeon General's 50th anniversary report on the health consequences of smoking, nicotine increases heart rate and cardiac contractility, transiently increasing blood pressure, and constricts the coronary arteries. What is not currently understood is how much it is the nicotine versus the other chemical components of conventional smoke leads to heart attack or stroke. Other reported impacts to the FDA, which are published on the FDA's website, include pneumonia, congestive heart failure, disorientation, seizure, hypotension, and others. There are also health and safety concerns. There's a lack of quality control. The FDA did conduct tests in 2009 to look at the ingredients from 2 leading brands of e-cigarettes and found levels of cancer-causing and toxic chemicals, including diethylene glycol, which is the active ingredient in antifreeze. In some cases, cartridges that were labeled as containing no nicotine did indeed have nicotine. So even if you have a patient that comes to you and says, well, I'm using zero nicotine cartridges in my e-cigarettes, there's no way to prove that short of sending the material into a lab. And at this point, Michigan does not have the capability to do that sort of testing. There's also, of course, as I mentioned before, the lack of regulation. The FDA is not regulating the manufacture of e-cigarette components or content at this time. There are also safety concerns. E-cigarettes have exploded or caught fire across the country due to faulty components, and there are risks associated with overcharging the devices. Unlike your cell phone, if you leave it plugged in overnight, the charger is sophisticated enough that it will cycle on and off, so that once you hit 100% of your battery and it's fully charged, it will no longer continue to charge the battery so that it doesn't short out the battery and cause fire. E-cigarettes are not currently that sophisticated. There have been many cases throughout the United States and around the world in which the e-cigarette has overcharged in the car and exploded, or at home and lit upholstery or curtains on fire. There was actually a case of a child who was severely burned in Utah earlier last year when his mother's e-cigarette exploded in the car and shot into his car seat and was trapped underneath him until she was able to remove it. Additionally, you must consider that the Consumer Product Safety Commission is not regulating the manufacture of e-cigarettes or their components. And perversely, as big tobacco enters the market, you can expect the quality to improve and that they will use this as a selling point. Other e-cigarette risks have included explosions, fires, poisoning, as I mentioned before. It does enable the discrete use of other drugs, such as heroin and marijuana. At this point, it is not possible to smoke crack cocaine with them yet, or methamphetamine. But if you look on YouTube, enterprising individuals are trying to figure out a way to tamper with the electronic output of the batteries so that they burn hot enough to be able to vaporize those substances as well. Additionally, there's the hazardous waste and litter component. E-cigarettes are treated by users as they would a cigarette. So what happens to that empty cartridge? They throw them out the window like a cigarette butt. But unlike cigarette butts, they don't squish underneath your tires. Instead, they puncture them. This was reported for the first time in the country out of Bay City. And finally, there have been a lot of situations in which children in the United States have become gravely ill from ingesting the e-cigarette fluid. An Israeli toddler actually died last May after she ingested her grandfather's refill fluid. There are also social concerns. Healthcare providers should care about the social context of e-cigarette use. This is where your patients are getting their information in the vacuum of information from reliable healthcare sources. E-cigarettes represent social norm reversal. They are marketed to maintain addiction, and they are playing out of Big Tobacco's playbook. They're back on television, they're in the workplace, they're in schools, and they're making false health claims. Many of you have probably seen the media blitz that continues. They're on social media. They encourage extensive experimentation. And now there are smokers or vapors rights groups. YouTube videos featuring advertising and user reviews and how-tos to create your own refill fluid or to tweak the energy output of the device are rampant. Twitter is used to rally smokers' rights or vapors' rights groups to fight local and state regulations, as New York City is now seeing. You also see brand misappropriation to promote e-cigarette sales, as in the case of the image on the lower left, which is the e-liquid Pure Michigan flavor. In March, several senators at the federal level introduced a bill that would make advertising of e-cigarettes to minors illegal. They just came out with a report detailing the extent of marketing and how it is aimed at youth on Monday this week. So where is the public health community? Public health community is actually divided. We have on one side those who call for abstinence or complete cessation versus those that argue for harm reduction. We must remember that tobacco companies are heavily invested in harm reduction strategies. E-cigarettes are just another product in a long line of harm reduction. It's where flavors like menthol came from and filtered cigarettes. And we now know that those innovations that the tobacco industry came up with did not improve health outcomes. Voluntary associations remain deeply concerned about norm reversal, secondhand vapor exposure, long-term use, the current vacuum of the evidence base, which is rapidly being filled, but it will take quite some time for that evidence base to be filled, and of course for us to see the long-term impact of e-cigarette use. They are also deeply concerned about youth initiation and dual use or addiction exchange rather than cessation from conventional tobacco products, other carcinogens, and of course, the concept of safer does not equate to safe. So what are the clinical concerns? Remember, these e-cigarettes are not FDA approved for cessation. They are not FDA regulated for safety. They promote dual use or shifting of addiction from conventional cigarettes to e-cigarettes. The health impacts remain largely unknown. They are attractive to youth and are functioning as a gateway phenomenon. And the concern about poison in children. Studies are split, in particular, on whether e-cigarettes are going to prove useful as a tobacco-dependent treatment tool. The latest study shows that e-cigarettes are not increasing quit rates. The study is in the JAMA Internal Medicine, March 24th, 2014, titled A Longitudinal Analysis of Electronic Cigarette Use and Smoking Cessation. If you're interested, I can send you the link. So what is a clinician to do? Well, start with education. Educate your patients and your staff. Remind them that e-cigarettes are not an FDA-approved cessation medication or device, and they're not even regulated for safety. Remember that there are 7 FDA-approved medications for nicotine replacement therapies that are on the market and available that are evidence-based and proven to be safe and effective in helping people to quit their addiction. Use the 5 A's. Remember that this does not need to be done solely by the physician. Share this effort throughout your practice. First, ask. Ask about e-cigarettes and other forms of tobacco use. I say this because many people do not consider e-cigarettes to be tobacco products. So if you ask only about tobacco use, your patient may well answer no. Part of the ask is to find out why your patient is using e-cigarettes. If they say they are trying to quit smoking, this may be a golden opportunity to offer evidence-based tobacco dependence treatment that you know is safe and effective. Advise. Share that e-cigarettes are not FDA approved or regulated and are not a safe alternative to conventional tobacco use. The best health approach is to quit using all forms of tobacco or nicotine. Assess. Is the user willing to make a quit attempt? Assist. For a patient willing to make a quit attempt, offer support and FDA-approved pharmacotherapy to help your patient. If your patient is uninsured or covered under Medicaid or the Healthy Michigan Plan, you can also refer your patient to 1-800-QUIT-NOW or the 1-800-784-8669. Fax referral is available. Now, I must have a disclaimer here about this. E-cigarettes are such a new phenomenon that quit lines across the country do not yet have established protocols for e-cigarette users. And indeed, most users consider themselves to have successfully quit tobacco. So they are not calling the quit lines by and large at this point. Many of those who do call the quit line, who are e-cigarette users, are dual users and are trying to still get off of conventional tobacco products. That said, it is important to plant the seed that e-cigarettes, when including nicotine, are a tobacco product and should be considered as such. At present, the Michigan Tobacco Quit Line is screening for use, but at this time we are merely collecting that data so that as the information comes available and evidence base is established, perhaps there will be a way for the quit line to be able to help e-cigarette users completely quit their addiction and put the device down once and for all. And finally, arrange. Support your patient through their quit attempt. A simple call and an expression of "you can do it" can really help a patient through a difficult period. Your support really does matter. What else can be done? Tell the FDA about faulty tobacco products. This is an excellent new opportunity that is available. This faulty means either the device or responses to the fluid itself. If you have a patient that approaches you and says, "I was trying this and it made me have a terrible cough, it gave me pneumonia, it exploded and caught my living room carpet on fire," anything like that, you can provide this safetyreporting.hhs.gov website to the patient, and they can report this directly to the FDA. And the FDA is collecting this data as they look forward to regulating these products. Next, you can also contact Tobacco Free Michigan for the latest on legislative activity in the state of Michigan regarding electronic cigarettes. And finally, you can always contact me or my colleagues at the MDCH Tobacco section if you have any questions. Please do keep us informed of local issues. If you have stories from your patients, if you have stories from your local community, this helps us to paint the picture accurately for the entire state. Thank you.
Thank you, Laura. That was a great presentation. Ashlyn, if you can please open the lines for questions.
Okay, ladies and gentlemen, if you have any questions at this time, please press the number 1 key. Again, if you have any questions at this time, please press the number 1 key. And there are no questions at this time.
Okay, if you can please post the survey. We wanted to thank Laura and all of our participants for joining us today. If you have any questions after this presentation, you can feel free to email dash@empo.org, or Laura has supplied her contact information. Before you log off, if you could please complete the survey questions. And once you do that, have a nice afternoon.